Hello, my name is Gutierrez, and I will be representing Medtronic, a medical technology company. My position is a senior coronary and vascular representative. I will be presenting to Dr. James Scanlon of the vascular surgery branch of Naples Community Hospital, and he will be played by Alexa Parisi. Dr. Scanlon is looking to find a new medical supplier for his vascular surgery branch, and is looking for something that's more technologically advanced than what he currently has. I'll be attempting to sell stents and aortic valves to him. My two handling objections are put off and trial use, and my closing strategy is forgot something. Hello, Dr. Scanlon. I'm Joel Gutierrez. Nice to meet you.
Nice to meet you, Joel.
I heard you were in a triathlon recently.
I was. I actually just finished my fifth.
Oh, yeah?
Yeah.
Very cool. I could never even attempt to do that, so...
Well, I mean, it's quite difficult, but once you train for it, you get it down.
Even the training. Well, let's get down to business.
Sure.
My company, Medtronic, is the largest medical technology company in the world. And we are based in Minneapolis, Minnesota, and founded in 1949. So we've been at this for a long time.
Yeah.
Just last year, over 8 million people either used a service like therapy or one of our products, just from conditions ranging from cardiac to neurological. So
It's impressive.
very wide range of services. I myself am a UF graduate. I have a degree in civil engineering and a minor in sales engineering. And I learned from one of the best salesmen in our company's history. He is now the vice president of sales for our company.
Wow.
And I'm well trained to handle any questions you have and assist with all your surgeons and other doctors with our product.
Oh, great.
So, if you don't mind me asking, what needs in particular do you have?
Well, here at the vascular surgery branch of Naples Community Hospital, we've been using the same equipment for quite some time now. So we're really looking to, better our technology and improve on the equipment that we have. But we're really looking for the best products at a reasonable price.
Okay, very good. I think that's a great decision. Not many people would take the initiative to actually go out and get more advanced technology when they're perfectly fine with what they have already. So, very, very good decision. With your permission, I'd like to continue with the presentation.
Sure.
Okay. One of the biggest features that my company can provide you is we have the best drug-eluting stent on the market.
Mm-hmm.
It's called the Resolute Integrity Zotorolimus Eluting Coronary Stent, and it was approved by the FDA just this year, actually, February 22nd, I believe it was. And it's designed and marketed for diabetics as well as just the typical coronary artery disease patients.
Mm-hmm.
Would you like to hear some about our clinical trials?
I would love to.
The demographic was very diverse. We had an average age of 69 years old, and 33.6 of those were diabetics,
Mm-hmm.
with 9.5% of them being insulin-dependent diabetics.
Okay.
21.6% of our people were current smokers, which takes a big toll on the heart,
Mm-hmm.
as you know. And then, as you can see here, we had a 98.6% success rate with only a 0.9% death rate.
That's very impressive.
Yes, and would you like to hear some about our design?
I would love to.
The design itself is unique in that it doesn't have a tube going through the wiring.
Mm-hmm.
The wiring itself is just one continuous ultra-thin strand made up of a cobalt chromium alloy.
Okay.
And it's formed in a sinusoidal sinusoidal pattern,
Mm-hmm.
and then wrapped in a helical pattern.
Okay.
So because of this design, it makes it more flexible, and that allows it to bend in 3 dimensions as opposed to typically just being in 2 dimensions because of the joint that is usually in it.
Okay.
With this flexibility comes a much better deliverability. Because of the flexibility, it only requires 20 grams force to actually implement it into the patient, which, as you can see here, is less than 1/3 of even our competition's best stents.
Yeah.
So it makes it much easier to deliver that to the lesion site.
Yeah, that's impressive.
Would you'd agree that this is something you'd be interested in?
Oh, definitely.
Okay. Well, seeing this superior technology with the data that I've just presented you and the ability to use it in diabetics, would you consider actually buying this product?
It definitely has the potential to save many lives. My main concern is with the training, and I fear both losing lives and time having to train, surgeons with the new technology.
Okay. Well, I just want to make sure you're concerned about losing a lot of time with your patients and patients themselves in the process of training for this.
Yes.
Okay. I mean, that is a very valid concern, a very good question. But if you wouldn't mind, I have a point in my presentation that addresses that.
Okay, that's fine.
Okay. With your permission, I'll continue?
Yes.
Okay. Another great feature that my company can provide you is called the Melody aortic valve. And the difference between this aortic valve and my competition's is that it is implanted in a different way. The method by which it's implanted is a transcatheter method.
Okay.
Meaning we go up through the femoral valve or femoral artery and can install it through there, making it far less invasive, and you don't have to put your patients under the knife for open heart surgery, which obviously makes it far less risky.
Yes.
With your question about training, it applies to both the aortic valve implementation as well as the stent implementation. It can all be done in one sitting in one day, so it won't take much time, and it's safe for your patients. All this technology is tested, and I've been trained to help assist surgeons such as yourself to actually learn how to use this.
Perfect.
And just an added bonus, the FDA this transcatheter valve or heart valve is the only one of its type, is the first approved by the FDA.
Okay.
And it's safe for use in children and adults.
Okay.
So, don't you feel that this would save a lot of lives for your hospital?
I do.
Well, after seeing our value analysis that shows the effectiveness of our new DESs and the less invasive implementation of our Melody heart valves, do you feel comfortable making a deal with Medtronic?
I definitely think that it has the potential to save many lives. The less invasive procedure sounds great. However, I don't want to limit myself to just the transcatheter method. So that's my main concern.
Okay, that's a very good question. I just want to make sure you just don't want to have to narrow yourself to one option with regards to aortic valve implementation.
Correct.
Okay, I understand your concern. That's perfectly normal. But we do also offer a surgically implementable aortic valve.
Okay.
So that's just one option, is the transcatheter valves.
Okay.
And but to show you that you won't be disappointed with our Melody aortic valves, I'm willing to offer you a sample use of those valves, just so you can test them out before actually making a commitment to buying those.
Okay, that's a very good offer.
Okay. Do you have any other questions regarding the valves in particular?
I don't have any other questions at this moment.
Okay. Well, I'm glad to hear that you understand all that our valves have to offer. Do you have any questions regarding Medtronic Medtronic itself and all that we can offer you?
Yeah, I just wanted to, figure out the comparison between your competitors' prices and your prices. I mean, are they, relatively the same?
Yeah, that's a very good question. All of our prices are, it's the same across the board for all of our competitors. So we're priced at the same price as they are.
Okay.
So does that answer your question?
Yes.
Okay.
Thank you.
Great. So just to recap, I came today because you wanted to upgrade your vascular surgery equipment and you wanted some more advanced and effective technology.
Mm-hmm.
I promise that if you sign with Medtronic, that we will meet your expectations, if not exceed them.
Great.
As I've told you, our Resolute Integrity stents are the best of its kind, and it provides an extraordinarily high success rate, as well as a high deliverability, and you're allowed to use them with diabetics.
Great.
Also, the transcatheter method for our aortic valve implantation is available with our Melody valve, and will allow you an alternative to surgery if necessary.
Okay.
Because you do have the option to use the surgically implementable valves.
Okay.
Both are well tested and safe, and I don't want to push you, but seeing as you do not have any more questions, would you like to sign Medtronic on as your medical provider for all stents and aortic valves?
Typically, I would need to think this over, but your product seems very effective and has a lot of different uses. So I would be more than happy to sign with you today.
That's great news. I'm glad to hear that, Dr. Scanlon. I will get a contract printed up for you immediately, and I'll be right back.
Okay.
It's been good meeting with you.
It's been good meeting with you too, John.
Oh, and before I forget, I forgot to tell you that I will cover the cost of your shipping. So, with regards to any of your concerns about price, that will save you money in the long run if we offer you free shipping throughout our contract.
That's great. Even better to sign.
Awesome.
Thank you.
Nice to meet you, Dr. Scanlon. Have a great day.
You too.
Perfect.
Yay!
We did it. And it's 11 minutes.